Hello and welcome to At the Heart of Health with Dr. James Marcum. In today's well-marketed world, it's hard to know who or even what to believe when it comes to health care. In each program, Dr. Marcum, a board-certified behavioral cardiologist, takes a balanced approach using common sense modern medicine and the ultimate source of truth, the Bible, recognizing that at the heart of health is love.
I'm Dr. James Marcum, and I'd like to welcome you to Heart of Health. One of the topics that I've been most interested in recently is how do we keep our bodies healthy as we age? What are little tips we can do, especially as we're all getting older? This is something everyone should be interested in. Today we have as our guest Dr. Ken Scott. This is a doctor I've worked for quite a while. Ken, welcome to At the Heart of Health.
Thank you.
And let's talk a little bit about how you've got to this point of your life. Tell us about how you've arrived at being the Chief Medical Officer now at Life Care Centers of America.
Well, my background is I'm board certified in internal medicine, and I have worked as an internal medicine physician for about 16 years. Early on when I started my practice, the whole idea of the hospitalist, an internist that is focused on just hospital care, came into being, and I was early on in helping to form hospitalist groups in the state of Tennessee. That's basically what I've done for 16 years, as well as being the medical director of various nursing homes during that time. Thus, my interest grew in both geriatric medicine and taking care of the elderly in a nursing home setting, as well as taking care of the critically ill patients in a hospital setting. And because early on I was involved with the hospitalist idea and concept, I was naturally asked to help form groups, build groups, etc. And so I took on a management role during those 16 years with various hospitals, serving on committees, board of directors, and running hospitalist groups for hospitals. And that's how I got to where I'm at.
Yeah. Now, for our audience, hospitalist, that's a doctor that specifically specializes in taking care of inpatients, correct?
Correct.
Now, do they do outpatient work, or they just take care of the inpatients?
Basically, it's all inpatient work. Kind of a natural extension to the hospitalist idea is to move into the nursing home setting, which is really almost like a small hospital setting. And so lately there has been a lot of movement towards considering hospitalists in nursing homes as well. They're thinking about giving it a different name. Nursing home specialist or SNFist is some of the terms that have been applied to that. But basically no outpatient work. It's all in hospital or in an institution type of work.
And it seems like in the medical community, you've sort of been at the very start of this whole hospitalist movement. I remember when we didn't have this.
Right.
And now we've got this specialized care of the aging. So I think we're going to have a great program today. We're going to talk about these issues and answer questions from all over the country on this program. Thank you for joining us, and we're going to be right back after this short break. I'm Dr. James Marcum, and I talk to patients every day who want to know the truth in healthcare. On our website, heartwiseministries.org, you can have your questions answered. You can read my blog where I talk about interesting and controversial subjects in medicine. You might choose to go to the radio or television sections and learn more about all sorts of health topics. Take the time and go to heartwiseministries.org.
You can easily spend $90 on an expensive meal out. How about investing $89.94 in your future? Just think about the possibility of coming off those prescription pills and getting rid of all the side effects. Think about feeling better than you have ever felt in your life. this is all possible for you. For only $89.94, you will receive a 7-part DVD series, Weight Management by the Book, a 30-lesson workbook with over 100 recipes, and if ordered today, exercise tubes will be included for free to help with your journey. There are many programs available, but this unique program has identified the truth about how to manage weight. This program is not available in stores. This limited offer will not last long. Pick up the phone now and dial 877-504-9628. Operators are standing by. This call will change your life forever.
Two words for you. Pop quiz. Ready? Name any funny movie. A drama. Name a mystery. And one more thing. Name the movie your kids saw today in science class.
Know what really matters. Know about your kid's school. And know about your kid. Find out 100 ways to know more, do more.
Welcome back to Heart of Health. Joining me today is Dr. Ken Scott, who is the Chief Medical Officer of Life Care Centers of America. We're going to discuss different questions that have come into HeartWise Ministries, and if you'd like your question answered, go to our website, which is heartwiseministries.org. Dr. Scott, our first question comes from the Pacific Northwest, and this is a dear 86-year-old female. She says, I'm concerned as I get older. I'm concerned about many health issues. And she asks, what are some things that I can do to stay healthy as I age? So this is a person that's pretty healthy, that wants to stay healthy, that realizes this old body's going to start breaking down through the years.
Well, to start with, let me say, good for you for staying healthy. I think the most important thing right off the bat is to say that if you want to be healthy as you age, you need to start young.
Right.
Too often we find out later in life that we've really used up a lot of our good body structures on doing things that are not healthy for us, and then we're trying to reverse it afterwards, and that's a lot harder than taking care of our bodies early on and seeing that progress throughout our lives. As far as what to do, I think there's a couple of things you have to look at. One is, what are the big killers in old age, and the main things still are heart attacks, heart disease, strokes, and cancer. Those are the biggest killers. And the other thing is, what are chronic illnesses that the elderly face? After the age of 65, about 50%, or about 80% actually, of elderly people over the age of 65 carry at least one chronic disease, and about 50% carry 2 chronic diseases. And these are things that to some extent can be prevented if we're working on it earlier in our life. The chronic diseases are things like high blood pressure, diabetes, arthritis, osteoporosis. And these are things that we're seeing now in more prevalence in society as we age that we didn't used to see so much because our society didn't live to be so long. I think the most important thing that I would stress right off the bat is exercise.
Okay.
There's no doubt that getting good exercise can ward off a lot of these things. It can help with blood pressure. If you can control your weight with exercise, you alleviate a lot of the symptoms of diabetes. In fact, some people for type 2 diabetes have managed to get off their medications by losing weight and exercising regularly. It helps with cognition and memory to exercise. It helps our mood. As we age, we often develop depression, and it helps alleviate depression.
Now let me stop you here. What type of exercise would you recommend as we get older? Is there any specific exercise is better than another?
I think there's a lot of different exercises you can do. If we were going to categorize it, I would say number one, aerobic exercise has to be part of it. That is what is heart healthy and can help with weight loss, etc. But beyond that, we need to do muscle building exercises, because as we age, a lot of things that we see in patients that come in are falls, hip fractures, and if we strengthen our muscles, we can actually prevent that. Balance exercises are important to do as we age. because that helps prevent falls as well. And then stretching is important.
Now, when you say aerobic, that's like walking or swimming or?
Walking, swimming, running, bicycling, any of these things that get our heart rate up and are things that you would normally think about athletes doing other than the weightlifting type of things.
So we have this 86-year-old that wants to be healthy, so you've thrown out exercise, and very important. Anything else that she can do to help as she gets older?
Well, and of course I don't know her lifestyle, but some of the things that are important is if she smokes, it's always a good idea to quit smoking. And of course, alcohol is something that a lot of people, if they've done it earlier in life, continue to do after the age of 65. It's much more dangerous and it's harder on your body if you're mixing prescription medications with alcohol. And so that's something that should be stopped. There are some other preventative things that are good to do. Getting your immunizations are important. Actually, you know, most of the cases of tetanus in the United States are people over the age of 65.
Wow. What do you think about the flu shot and the shingles vaccine?
I think both of those are important for people over the age of 60 or 65 to get that. The pneumonia shot, of course, doesn't prevent all types of pneumonia, but the worst types, the ones that are most likely to cause death, in the elderly population are covered by that. And even if you do get pneumonia, your case should be lighter if you've been immunized. So the shingles vaccine is important, the pneumonia one is, tetanus is, and yearly flu vaccines are important.
Well, that's a lot to remember. So, but exercise, all the preventive maintenance, if all these are important. Now, real quick, I heard one of the leading causes of death in the elderly is medications, hospitals, procedures, and actually doctors. We're going to talk about this in a second. Friends, I hope you might have a question for us on HeartWise Ministries. Give us an email or call. We'll be right back after this short break.